please talk about the vagina more. Sexual health and reproductive health, this is health
It's
care.
health.
I see the effect that this has on my patients in terms of their personal lives, how they see themselves, how they perceive themselves, but also their relationships change
Yes.
as a result of difficulties with intimacy at times. And that is really important to address.
How does that work with virtual care if you're having vulvovaginal symptoms?
Right.
I mean, don't you need to look at it?
No, not necessarily.
necessarily?
So genitourinary syndrome of menopause is the complex of symptoms that are when the estrogen levels feed the tissues of the vagina, the bladder, the pelvic floor. And when estrogen levels decline, your tissue gets thinner. You may feel more dry. It can be uncomfortable to have sex or intimacy with self or partners. There's a whole spectrum of symptoms that happen in terms of the vaginal health. And then there's also the bladder health, where we see things like recurrent bladder infections happen, more frequent urination patterns or urgency. So that complex of symptoms is often undertreated because patients don't talk about it and we don't ask about it. And it's really on us to do that. So we are seeing our patients for Pap testing, or now it's HPV testing. We're doing these tests and we don't mention it, and our patients are uncomfortable. This is where I stop doing a Pap test and I say, I'm not going to do a Pap test. We're going to treat this first. And I want to see you in 3 months. Once you're treated, your tissues are less uncomfortable. They are more well lubricated. There's options for treatment. And I'd say this is an area that is really under discussed. And we have excellent, excellent treatment for people going through this.